المحاضرة الثانية بعنوان أوميجا 3 and evidence based complementary medicine للدكتور ريحان زيدي integrative medicine to accredited Canadian Medical College that includes Acupuncture, Homeopathic, Herbal and Nutritional programs, published author, international speaker, and curriculum developer for college and university medical programs around the world. تفضل يا دكتور ريحان.
Bismillahirrahmanirrahim. Assalamu alaikum. I'll try to fly through the presentation because I don't want to get kicked off. Maybe we'll have questions after this. I know it's a topic that a lot of people are curious about. So I'll try my best to go fast. That's all I can promise. Okay, so essential fatty acids. Each of our cells have a lipid bilayer, and fats are particularly necessary for the healthy functioning of the bilayer, as well as various other functions of the body, from hormones to repair, to you name it. Every function has a lot to do with the oils in the body. They're essential and non-essential. And if people are familiar, have some to a nutritional background, then they might understand the difference between essential and non-essential. Either way, among the essentials, there is something called omega-3 and omega-6 fatty acids. Have people heard of omega-3 and omega-6? It's kind of getting popular nowadays. Okay, so omega-6 fatty acids, they're largely from, they're a lot of the oils that we get from meat products, from red meat, from even actually chicken. Actually, it's also, people always say it's the white meat, but white meat in terms of chicken is still omega-6. Fish actually is the one that has omega-3. Dairy products, a lot of even vegetable oils carry omega-6 fatty acids. Fatty acids are directly linked to inflammation. Everyone understands what inflammation is? Okay, the response that the body gets after there's a stressor, an injury. For example, you get hit, the fatty acids in the bilayer or in the body get cleaved, there's an inflammatory reaction, and either it can be highly inflammatory or it can be moderately inflammatory, or maybe there's no response depending on stress. So a lot of the dairy products, for example, have high omega-6 fatty acids. In our diets currently, because of the way, from various factors, we eat too much meat, we have too many omega-6 fatty acids in our diet, which makes us highly inflammatory. And I'll show you a small diagram of it. Next. We'll talk about fish oils. Fish oil is the other essential fatty acid, which is omega-3 fatty acids. Omega-3 fatty acids they have the same pathway, they're used similarly like omega-6, but they are less inflammatory. They carry two particular ingredients that are really important, EPA and DHA, Eicosapentaenoic acid and Docosahexaenoic acid. So fish is the only source at this time that we know of that carries both these oils. And you'll see why it's really important in the next slide. Alright. Let's get my turn. Okay. So this is the omega-3 family, this is the omega-6 family. Basically, the omega-6s, which is linolenic acid. You might have heard of linolenic acid. That's another way of saying omega-6. Is basically digested, and metabolized into the body and used in its various end product from inflammation by going through this reaction. And this is my pointer to die the last one. All right, so it's coming down this pathway, and the red indicates prostaglandins and inflammatory end products that signal all the pathways of inflammation. The red signals high inflammation, which is right there. The omega-6 family also very similarly goes down that pathway, but Eicosapentaenoic acid and Docosahexaenoic acid, they end in lower inflammatory products. So the prostaglandins and the leukotrienes that are produced by the omega-3 when they're stress on the body, let's say an injury, are less inflammatory. Let's move on. There's a different diagram showing a very something similar, but in from arachidonic acid, which is the original acids on top in the previous diagram. It shows that when the arachidonic acid, which is a fatty acid, okay, the fatty acids we were talking about, when they're broken down, they lead to prostaglandins, and it causes inflammation, pain, swelling. That's what inflammation is, right? So I wanted to show a particularly unique difference between the place of these natural therapies in palliative care, in patient care, compared to conventional treatments. So we had one of the doctors, I think from the NHR, who came and said, palliative care, you don't have palliative care without morphine, which is an excellent statement. I also want to say, you don't have palliative care without complementary therapy. Why? Because the importance of acute pain management is necessary, but at the same time, one of the other doctors said, if someone has 6 months to live, he has 6 months to live. And these natural therapies, what they do is they improve the patient's quality of life, because you're resolving the problem at its root. So if you have your fatty acids, the arachidonic acid, ends up going through the inflammatory pathway, producing prostaglandins, COX-2 inhibitors, which is like ibuprofen, things that people conventionally use, they will inhibit the reaction from reaching, in a high degree of inflammation by blocking the pathway, which is great, which is very needed sometimes. At the same time, if you use natural therapies, such as fish oil, it converts the source fatty acid, such as arachidonic acid. If it has, the sources are Eicosapentaenoic acid or Docosahexaenoic acid, DHA or EPA, then it doesn't work by blocking the COX-2 pathway. They're not COX-2 inhibitors. It ends up decreasing the amount of prostaglandins at the end because the source is different. Because the arachidonic acid is not the one that will end in such inflammation. So basically, without having to use ibuprofen or various drugs that may have side effects, you are able to decrease pain, which is an incredible method of treatment. It has benefits from, because once you solve inflammation in the body, you decrease all the problems that are associated with inflammation, from heart disease to pain to autoimmune conditions, and I'll list a few others in the next slide. This is a joke. I think I have time for a joke, right? It says, oh, wait, I have time for a joke. This is our little comic that says, say goodbye to hangnails. Do you know what a hangnail is? Anybody know what a hangnail is? It's a little piece of skin that's at the end of the nails. Just a little piece of skin. It says, say goodbye to hangnails. Now there's detox. A medical breakthrough that eliminates hangnails forever. Ask your doctor for detox. Side effects may include headache, nausea, diarrhea, fatigue, dry mouth, dizziness, vomiting, constipation, rash, nosebleed, viral infection, and etc. It's actually a little just a dig in the ribs saying that a lot of medications have side effects, but we accept that because of the benefits they provide. That's actually all well and good, because we know the benefits that they do provide, and we don't undermine that. But at the same time, conventional medicine has gone down a route that accepts side effects too readily. When I was in China, I went to a hospital, and they have kind of integrated wards, where you have one side of the hospital has conventional therapy, and the other side of the hospital has herbs. You just walk in, and there's these big pots, and people are like making herbs in these like pots. And all these patients are sitting on the side, the doctor comes, he checks their tongue, checks their pulse, writes something, and they get a tea, and they just sit and drink their tea. So I was interested with them. I said, why are you here? Why are you on this side of the hospital, not the other side of the hospital? There's good conventional treatment there. So what do you think the answer was? The answer wasn't, this is more effective, or because I feel better, or because I believe in more, or that's tradition. They didn't say any of that. They just said, because there's less side effects. It's excellent. It's an excellent form of reasoning. Because natural therapies have less side effects, people are attracted to them. And that's why we should also take advantage of them.
1 minute more.
So, next. Alright, so fish oil improves cardiovascular health, and American Heart Association, the American Diabetes Association have already confirmed that. I don't have time to tell you more about it. Next. Here's some of the studies. Next. Pain and inflammation. Fish oil has been examined as a treatment for a wide variety of autoimmune diseases, like we're talking about inflammation. Examples of autoimmune diseases include rheumatoid arthritis, inflammatory bowel disease, asthma, anything to do with inflammation anywhere in the body, because you're resolving what the body is made of, what it's composed of. And there's the study. Next. Fish oil improves concentration. Before that, concentration. Before. Sorry. Okay, yeah, improves focus, mood, memory. This is a study done on ADHD, which is all the way running parallels. We're just showing that it has an effect on the brain. The brain has a huge oil content, so fish oil seems to benefit the functions of the brain. Next, mood. This is So there's 32 studies which have been examined on fish oil for the treatment of depression. Now, I think some of the speakers have mentioned that fatigue, depression, these are all highly, there's like 80%, we find 80% of patients of cancer patients, palliative care patients, suffer from some form of depression. So fish oil is an excellent form of bringing that back up, along with exercise and these things. So 32 studies have been examined for fish oil for the treatment of depression, or depression associated with bipolar disorder. 9 of these studies use oil containing more DHA than EPA. My point I'm going to be making here is that we just went from, I tried to condense my presentation in 10 minutes, but there's essential fatty acids. Among the essential fatty acids there, omega-3 and omega-6. Among the omega-3, there's EPA and DHA. Among the EPA and DHA, there's a lot of research showing that it's the Eicosapentaenoic acid, the EPA, which is most effective. So I tried to summarize that here.
Thank you, Mr. Rehan.
Huh?
Thank you.
Oh, EPA is actually really effective, and my last point would be that people who are using complementary and alternative medicine need to understand the field properly. Not anybody can just use complementary medicine without being trained. So if you are studying and using complementary alternative medicine, if you're a medical doctor, then there's a lot of research out there to investigate, but at the same time, we should educate ourselves or use professionals who are trained in the field. And on a final note, if people are interested, there is a diploma that we're offering at the Palliative Care Training Center that Dr. Prashant told you of. We're training health professionals on how to use natural supplements. For instance, the details of EPA and DHA, how they work with certain conditions. If you'd like more information, then you can always contact us. And if not, then
Thank you.
Stay tuned for future developments in Jordan. Thank you very much.